Well, I remember one patient in particular who came to us. He was in his early 60s, and he had had some lab testing that indicated that he might have a hyperactive thyroid. And as a result of that, he was referred to an endocrinologist within our system. The endocrinologist began to treat him and actually found that this patient was getting worse the more he was treated for this hyperactive thyroid. And in fact, the endocrinologist felt like he didn't have symptoms of the hyperactive thyroid at all. The endocrinologist came to us, and this was really where the case turned. Because when the endocrinologist consulted with us, we were able to do testing on a different instrument from a different manufacturer and to be able to show that first set of lab results was incorrect. There was another instrument that gave results that were very consistent with the patient's clinical picture. And this gave the clinician confidence to change the patient's treatment, and in fact, the patient improved remarkably. So this was really a great advance in terms of the treatment of this particular patient. But we actually wanted to go further than that, and we wanted to understand why it was that this patient had these particular lab results. And what we were able to find after a lot of investigation was that in fact this patient's own body made an antibody that binds to a common component of laboratory tests. This was interfering with the patient's laboratory test. And in fact, we were able to show not only that it affected the thyroid function tests, but also that it affected a number of other tests that contained this common component. And even if you looked at tests from different manufacturers that contained this component, the patient would have abnormal results. And this was a really important thing to understand, because we knew that this patient came from an area in our state that had a regional medical center that used instrumentation that contained this common component in its tests. And so we realized that if this patient went into the emergency room, for example, wondering if they were having a heart attack because they had chest pain, they could get a lab result that would appear to be wrong, and in fact could lead to misdiagnosis of their condition because of this thing that their own body made. So what we were able to do then is to give the patient a letter describing exactly what was going on, so that that patient would be able to inform their particular clinician or provider of what to expect from the laboratory tests. So I'm Dr. Stephen Master. I'm an associate professor of pathology and laboratory medicine at Weill Cornell Medicine, and I serve there as director of the central lab.